I hope this is a helpful video. We're going to talk about what you can do at home and what we rhinologists can do in the office to control nosebleeds. What we're not going to be talking about is prevention, so things like nasal saline sprays and gels and things to moisturize the nose to help prevent nosebleeds. And we're not going to talk about the most severe nosebleeds that require going to the operating room. We're going to focus on the more common nosebleeds that I see on a daily basis, ones that maybe are not so severe they take patients to the ER or emergency room, but they're severe enough to really cause a detriment to people's quality of life. And I would say a lot of patients live with daily nosebleeds, or at least weekly to monthly, and think it's just part of life, but we can fix those. Okay, so you're at home and it's bleeding. What are some things you can expect and things you can do? First, I think it's helpful to explain what's coming out of your nose. And so there's different stages of bleeding, and that will dictate what you see. When it's actively bleeding, you'll see thin, bright red blood, and depending on how large a bleed, it might be high flow or low flow. Now, if the bleeding slows a bit, but it's still bleeding, your body tries to make clots, and so this is going to form this thick, bright red blood that's sort of gelatinous mixed in with thin, bright red blood. Then, as the bleeding slows substantially, the clotting process takes over and the blood sits in the nose. It gets oxidized and turns darker colors, but because there was a significant amount of bleeding, you can actually have very large clots form. They could be 6 or more inches long and frankly look like slugs coming out your nose or that you spit up, and so they can be scary to patients, but just know that's actually a normal part of the process. My final point for this slide is just where to expect the blood to come from. It's going to either come out the front of your nose on one or both sides, or down the back of your throat, and you'll have to spit or cough it up. Now, it can also start bleeding out the front of one side of the nose, then it bleeds around the back of the nose and comes around the other side, and then it can seem like it's bleeding from both sides. So what can you do when this happens? Well, first, just try to breathe and relax. Generally speaking, nosebleeds are rarely life-threatening, and rarely will you need a blood transfusion. Next, it's a good idea to lean your head forward so you don't accidentally swallow or inhale blood. Then, find your nearest decongestant spray, some form of oxymetazoline, and give about 4 sprays or so to each side that's bleeding. This acts to constrict blood vessels, which should slow or stop most bleeding. And then probably the most important part is that with your head leaned forward, you hold tight pressure for 10 minutes with your fingers on your nostrils against your nasal septum, which I'm going to show in a picture soon. And you try not to let go. It's not always easy. Now, I always tell patients if the first 10-minute trial doesn't work, you try it all over again. 4 more sprays each side of bleeding, hold the pressure again for 10 minutes, and usually with 2 of these trials, we see around 90% or more success in resolving or substantially slowing the nosebleed to where patients don't have to go to the ER. Now, I just want to show patients how to apply pressure to their nose when they have a nosebleed, because I see people doing this the wrong way. So you're just going to use your thumb and index finger, shown here. Apply good firm pressure to the nostrils against your nasal septum like shown there. What you should not do is hold the nose really high up where you feel the bones, because this won't apply pressure to the septum and it won't close off the nostrils so that the blood can sit in the nose and clot. And lastly, don't tilt your head back like this because blood can go down your throat and you might swallow or inhale it. Now, I told you to try 2 of those 10-minute trials of decongestant spray and pressure, but when should you go to the ER? Well, for one, if it's bleeding so fast out the front that you can't stop it or slow it significantly with the decongestant spray and pressure, it might be time to go to the ER. Additionally, if it's bleeding significantly down your throat despite the sprays and pressure to the front of your nose in a proper head position, that's another reason to go to the ER. And finally, if at any point during your nosebleed you're feeling lightheaded with a rapid heartbeat, chest pain, or shortness of breath, definitely go to the emergency room. Now, is there a management option that lies somewhere between you having to deal with these nosebleeds at home versus going to the ER? Well, that's where rhinologists come in. So how might us rhinologists help with your nosebleeds? For one, we use scopes and can pinpoint the exact area of bleeding and stop it without placing painful intranasal packings. We usually do this in the office with you awake, and we just spray the inside of your nose with numbing spray. In very rare instances, we can't identify the bleeding area or it's inaccessible in the office. If this happens, either we have to place a temporary nasal packing, or we have to go to the operating room to definitively control the nosebleed. The bottom line here is that nosebleeds are curable in nearly all cases, unless you have rare bleeding disorders, but even if you do, we should be able to improve your daily quality of life by decreasing the severity and frequency of your nosebleeds. Now I'm going to show you an example of somebody who came into my office after having been seen in the ER, had a pack placed, it fell out, he kept bleeding, He tried an over-the-counter nose clip shown here, which helps slow it, but it doesn't really stop it. So then he comes to my office, we take it off, and now let's deal with it. First, I spray a numbing and decongestant spray in that left side where most of the bleeding was, but I also took a look on the right side just to see if there was bleeding. Then we have to clear out all the fresh blood clot. This is that gelatinous fresh red blood clot that we talked about. Also some older clots. You're going to see me pulling out a long one here. And then we got to find the bleeding site. In this case, it was a little pumper right on the anterior septum. You can see how small it is, but that thing bleeds a lot. But we got it to slow with the decongestant spray. And then use silver nitrate sticks. Apply this chemical focally, which just locally burns the tissue, and sometimes it takes multiple applications. But again, we just apply it to the area of bleeding, and there you have it. It's stopped. Then sometimes I'll place a thin layer of this oxidized cellulose hemostatic material to help with wound healing, and that's how we control nosebleeds in the office.